Good evening. This is All India Radio, Kohima. I'm Jonas Yandan with Evening News. The headlines. 2,000 crore rupees allocated by PM CARES Fund for supplying Made In India ventilators to government-run COVID hospitals. Nagaland records second highest spike of COVID-19 with 50 new cases detected, taking the total to 330. Nagaland Cabinet approves creation of 186 posts under Health Department. And COVID Care Centre at Chumukedima in Dimapur became functional from today. Prime Minister Narendra Modi, CARES Fund Trust, has allocated 2,000 crore rupees for the supply of 50,000 Made in India ventilators to government-run COVID hospitals in all states and union territories. In addition, 1,000 crore rupees have been allocated for the welfare of migrant labourers. Out of the 50,000 ventilators, 30,000 ventilators are being manufactured by Bharat Electronics Limited. 2,923 ventilators have been manufactured so far, and out of which 1,340 ventilators have already been delivered to the states and union territories. By the end of this month, additional 14,000 ventilators will be delivered to all the states and union territories. In addition, 1,000 crore rupees have already been released to states and union territories for welfare of the migrant labourers. This assistance will be used for arranging accommodation, food, medical treatment and transportation of the migrants. Nagaland today recorded the second highest spike of COVID-19 cases after 50 persons were detected with the infection, taking the total positive cases in the state to 330. The minister in a tweet this morning said 312 samples were tested, out of which 24 positive cases were reported from Dimapur Quarantine Centre, 14 from Kohima Quarantine Centre and 12 from Bulletin Quarantine Centre. The state's total active case now stands at 189, while the number of recovered patients is 141. The union government today said that the recovery rate reached to 56.37% in the country, and a total of 248,190 people affected with coronavirus have been cured so far. During the last 24 hours, 10,994 people have recovered from COVID-19. Presently, the total number of active corona cases in the country is 178,014. As per the World Health Organization's Situation Report 154, India has one of the lowest deaths per lakh population. India's average cases of death per lakh population is 1, while the global average is 6.04. Health and Family Welfare Ministry said a total of 14,933 new cases of COVID-19 have been reported in the last 24 hours, taking the total number of cases to 4,40,215. At the global level, the number of confirmed COVID-19 cases have exceeded 90 lakhs, with nearly 4,70,000 fatalities. According to data compiled by Johns Hopkins University, 90,06,757 cases of novel coronavirus have been reported across the world. The United States continues to remain the worst hit, with 22,91,353 cases and 1,20,106 deaths, followed by Brazil 10,83,341 cases and over 50,000 deaths, and Russia reported 5,84,640 cases and over 8,000 deaths. Other countries with over 2 lakh cases include India, Britain, Spain, Peru, Italy, Chile and Iran. The State Cabinet has approved the creation of 186 posts under the Department of Health and Family Welfare, which will be made through open advertisement for all. The approval was made during the Cabinet meeting held today. This was informed by the Health Minister S. Pangyapom during an interaction with a section of media personnel at his office chamber. Principal Director Health and Family Welfare, Dr. Vizolis Sokre, said vacancies include 15 posts of specialist, 44 medical officers, 11 Ayush medical officer, 3 dental surgeon, 6 research scientists, 78 staff nurse, 6 lab technicians, 10 ECG technician and 13 OT technician has been approved by the government. He informed that the department has been allowed to go forward with certain modalities in the mode of appointment. In this, Dr. Sokre said the recruitment to the post will be through open competition. This news comes to you from All India Radio, Kohima. The COVID care centre located at Chumukedima in Dimapur became functional from today. The Health and Family Welfare Training Centre, Chumukedima, has been converted into COVID care centre, having 93 beds. This care centre will be taken care by CISHR in collaboration with the Health and Family Welfare Department. Deputy Commissioner Dimapur Anup Kinchi, in his address, acknowledged the selfless sacrifices of the medical staff and policemen working day and night, taking care of all the 67 quarantine centres. Calling upon the government employees to continue to work together in the fight against COVID-19 pandemic, Dimapur Commissioner of Police Rotihir Detsio exhorted the employees posted at Dimapur to take it as an opportunity to contribute towards the society during this time of crisis. India and China have reached a mutual consensus to disengage in the eastern Ladakh sector. In the Commander level talks between India and China at Malta, both sides agreed to disengage from all friction areas. AIR correspondent quoting Army sources reports that the Commander level talks between India and China yesterday were held at Malta in a cordial, positive and constructive atmosphere. Modalities for disengagement from all friction areas in eastern Ladakh were discussed and will be taken forward by both sides. This was the second meeting between the two corps commanders. They had met on June 6 and had agreed to disengage at multiple locations. India has said that respecting the international law, recognizing legitimate interest of partners, supporting multilateralism, and promoting common good are the only ways of building a durable world order. In his opening remarks at a Russia-India-China RIC Trilateral Foreign Ministers video conference today, External Affairs Minister Dr. S. Jaishankar said that this special meeting reiterates our belief in the time-tested principles of international relations. Jaishankar said Russia, India and China have been active participants in shaping the global agenda, and it is India's hope that RIC will also now converge on the value of reformed multilateralism. The centre has decided that Muslims from India will not go to Saudi Arabia to perform Hajj due to the corona pandemic. Minority Affairs Minister Mukhtar Abbas Naqvi today informed that he received a phone call from Hajj and Umrah Minister of Kingdom of Saudi Arabia, Dr. Mohammed Saleh bin Tahir Benton, suggesting not to send Hajj pilgrims from India to Hajj for this year. Naqvi said that the entire world is facing challenges of the corona pandemic and Saudi Arabia has also been affected by it. Meanwhile, the rituals for the most celebrated and world-famous Rath Yatra have started today amidst restrictions in Puri, Odisha. President Ramnath Kovind has greeted the nation on the occasion of Rath Yatra, especially the devotees of Lord Jagannath in Odisha. In his message, the President hoped that the Lord blesses everyone with courage and determination in the fight against COVID-19 and brings good health and joy to all. Prime Minister Narendra Modi has greeted the nation on the auspicious occasion of Rath Yatra. In his message, Modi hoped that the occasion brings prosperity, health and happiness to the lives of the people. Information and Broadcasting Minister Prakash Javadekar also greeted the people on the auspicious occasion of Lord Jagannath's Rath Yatra. And now 20 news, here are the main points again. 2,000 crore rupees allocated by PM CARES Fund for supplying Made In India Ventilators to government-run COVID hospitals. Nagaland records second highest spike of COVID-19 with 50 new cases detected, taking the total to 330. Nagaland Cabinet approves creation of 186 posts under Health Department. And COVID Care Centre at Chumukedima in Dimapur became functional from today. That is all we have in this evening news bulletin. Good night.